Good morning. My name is Brianna Long, and I'm going to be informing you about epidural anesthesia and a little bit about the history. What is the most excruciating pain you've ever felt, and what was your solution? If you've ever stubbed your toe, had a horrible migraine, recovered from a surgery, broken leg, etc., you may have taken over-the-counter medication, ibuprofen or Tylenol, or you may have been prescribed a pain medication like Tylenol 3. For women who have experienced child labor, for labor and childbirth, you know exactly what I'm talking about. Very, very excruciating pain. Women are not the only recipients of the epidural. Men can have them as well. Men can have a knee replacement, hip replacement. Instead of being put underneath general anesthesia, they can have a epidural. There is also a long line of history of epidural placement procedure. It all started with a Spanish military surgeon in 1921 and has been popular ever since. What is epidural anesthesia and how does it work? The term epi means above and dura means dura layer. An means without, anesthesia means anesthesia means feeling or sensation. You put it all together and it's without feeling or sensation. The epidural is placed between the L3 and L4 vertebrae. That is the very, very bottom of your back, close to your buttocks. A syringe is filled with an anesthetic called ropivacaine and is attached to a 25-gauge spinal needle and inserted into the intervertebral space and injected just above the dura mater of the spinal cord. An epidural catheter is then inserted to provide continuous dosage of the anesthetic via an infusion pump. So from my experience, I'm a surgical technologist and a surgical first assistant in labor and delivery. I've been in the surgical and operative field for about 3 years now. I've done other surgeries, gallbladders, knee replacements, any kind of orthopedic surgery, general surgery, but mainly I do C-sections. The history of the epidural. A board-certified physician in pain management, also a neurologist, named Dr. Nunquesa, states the very first single-shot epidural anesthesia was created by a Spanish military surgeon in 1921. Epidurals were not introduced to obstetrics until the 20th century and has become extremely effective for popular treatment for labor ever since. The percentage of women getting epidurals or other spinal analgesia has climbed to a high of 71% according to a Stanford study. 71% of women get epidurals according to the study, which appears online in anesthesiology. That is an increase of 10% from 2008 statistics. So this is 2021. And from my personal experience, I can definitely say that at least 97% of my patients get epidurals. And if you are having a surgical procedure like C-section, you will have to get anesthesia. Epidural, you can't do that natural. However, if you've ever had a natural birth, props to you. You're a superhuman. This is a picture of surgery in the 1900s. They called this the theatrical operating room. They basically treated it like a theater. However, surgery these days in the OR, the audience is restricted. Things have changed since the 1900s. This is the epidural placement, a visual representation of it. This picture is a little confusing right here. You've got your ligaments. There's 3 ligaments, I believe. I can't name them at the top of my head. However, this is the L3, L4 vertebral space. The needle is inserted right there. I'm guessing these blue things are the blood vessels or nerve endings. There's your nerve roots. The medication is injected just above this white in there. That's the dura mater. So it's above in the epidural space. This is a good picture as well. I found it on dummies.com. It was for a dad's guide to epidurals, kind of just to give dads a heads up, like what to expect. The patient is sitting in a position, they have their back kind of stretched out like a mad cat. That opens up the spaces right there. The epidural needle is inserted. A catheter is then inserted through the needle and into the epidural space. Catheter is taped in place, and then an epidural pump sends the medicine through the catheter. effects and risks. Of course, everything you do, every surgical procedure, walking out the door of your house, there's side effects and risks. So, low blood pressure via a mechanism called vasodilation causes nausea. So when you have anesthesia, your muscles relax, depending on what kind of anesthesia it is. But for ropivacaine, it completely relaxes your your muscles and your arteries. They relax and they open more, causing your blood pressure to lower. This causes dizziness, nausea, vomiting, all that good stuff. Itchy skin. So that's kind of a tough one right there. I'm not really sure why it causes itchy skin. Your pain and your itch receptors are kind of correlated and closely related somehow. I tried Googling it, couldn't find the exact answer. Lost control of your bladder muscles. So basically, we put a thing called a Foley catheter in you. It is a tube that goes up your urethra, and you pee in a bag. And it's not just for women either. It's for men who are having surgery. Infection rate is very, very, very low for this. We use an aseptic, sterile technique. We coat your back with iodine, betadine, chloroprep, or chlorhexidine, depending what hospital you're at. This is the same stuff we use to prep your skin before a procedure as well. It's all sterile, everything. Spinal headache. Not uncommon, but kind of rare, I guess. I mean, I've only seen it happen like a handful of times. This is when the needle punctures the dry matter and the cerebral spinal fluid leaks out. And it causes a very, very bad headache. We have to give you blood patches, and it's kind of a mess. Conclusion, epidurals have become more advanced through the years of 1920s. Anesthesiologists and CRNAs have gone through an extensive amount of learning and improving techniques. Do not let the risk scare you. It is better than being put to sleep, in my opinion. So if you are ever having a surgery, don't be afraid of epidurals, especially if you're expecting to have a kid. I would rather be comfortable than in pain. So this is interesting. I found it on Google as well. When you feel your back, you feel those little spiny rivets. That is called your spinous process right there. And your L3 and L4 vertebral space is where the catheter is inserted. Like I said, we make you arch your back a little, and that opens up the space and provides easy access. If you've taken A&P before, or if you're expecting to take A&P, spinal anatomy is very interesting to learn. Yeah, that's about it. Hope you guys enjoyed my presentation.